The article I chose to do my video on is about a trial that did single-dose psilocybin for a treatment-resistant episode of major depression. I am interested in psilocybin treatment, just hearing stories from other people about trying psilocybin themselves to treat their depression, whether it was a larger amount for like a therapeutic trip or microdosing. I just have heard that it helps treat whatever they're going through. And I do plan to do a program at Stanford. After graduating WSU, you have to be practicing for 5 years, but they teach you how to do psilocybin therapy and prescribing. So this trial was a randomized controlled trial testing out a new investigational drug called COMP360. It's a synthetic formulation of psilocybin, which was developed and optimized for stability and purity. Participants were 18 years and older and met criteria for major depression disorder, and also some screening tools for depression. The participants tapered off of any antidepressants they were currently on before starting the trial. There was 233 participants, and there was 3 different doses of psilocybin that was given. The dose ranges were 25 milligrams, 10 milligrams, and 1 milligram, with 25 and 10 milligrams being the psychoactive, like the psychoactive component being tested, and 1 milligram being like the control or the placebo. A single dose administration was given, which lasted 6 to 8 hours, and there was a assisting therapist that prepped the participants beforehand and was also present during the therapy trip. Let's see, all participants were giving a music playlist through headphones while wearing eye shades to help direct their attention inward, and they were allowed to go home after about 6 hours. The participants were also followed over 12 weeks post-administration. Let's see. So pretty much the results found that the participants that took the psilocybin 25 milligrams had the greatest long-term effect of a decrease in depression symptoms, and they also found that 25 and 10 milligrams had a rapid response of participants feeling significantly better by day 2. Let's see. The depression improvement was patient reported through like screening questionnaires, but also like clinician assessment. Both components were found to have improved depression. Let's see. The findings suggest that a subjective experience plays a role in therapeutic outcome for treatment-resistant depression, and the conclusion of this was this report of exploratory efficacy endpoints from the largest randomized controlled trial of psilocybin to date extends the evidence of the rapid efficacy of a single dose of psilocybin to benefits that are of paramount importance to patients, namely patient-rated depression severity, anxiety, affect, functioning, and quality of life, and further support development of this compound in the treatment of patients with TRD, or treatment-resistant depression. So the implications of this study are that there could be a possible treatment for patients with treatment-resistant depression. I think psilocybin does offer like, I don't know, it does something different for the subjective experience than our typical antidepressants and mood stabilizers. I think when done right, in like the right setting, it can really help patients open up and like let their guard down of whatever depression is holding them, whatever their thoughts are. I feel like psilocybin can help patients let go of whatever guards they have and explore what really is bothering them. So I think that's why it works so rapidly.